Welcome back to Beyond the Tube. Today, we are joined by the wonderful Mary from the Butterfly Pig. She is going to talk to us all about the incredible products that she has to offer, not just our Tubi kids, but lots of other kids who have got medical issues or maybe going through a tough time. Thank you, Mary, for joining us. I am stoked to have you, and I am a purchaser of your products, and I truly believe they are incredible. So I would love it if you could just tell us a little bit about how the Butterfly Pig became and what motivated you to start the business.
Yeah, thank you so much for having me on here. My background is in nursing. I actually started my nursing career in pediatric oncology. That's where first saw the need for these products because children learn best through play, but also the gold standard in patient education is for our patients to demonstrate understanding of what's going to happen. Yet we don't have that many tools that are kid friendly in order to do that for our pediatric patients. So I would use hospital supplies to like put a pretend IV in a teddy bear and demonstrate that way. But there's only so much you can do with that. I really saw the need for medical toys and wanted them myself. But it wasn't until mid pandemic, I was on maternity leave in 2020, that I actually started realizing maybe I could be the one to do that. It started very casually where I was actually making stuff out of clay. So somebody wanted a cochlear implant for a doll. And I was like, well, I'll make one out of clay for you. So I made it. Then she told people, then I got requests for hearing aids and then G tubes. So that's when I thought, okay, I can't have all these people walking around with clay, like G tubes and hearing aids for their dolls. Like that's not even a toy. Like I don't even know if that's safe. Thankfully they were older kids. So I thought, you know what, we need to make toys that are actually certified in toys that are safe and that are more scalable.
Mhm.
So that kind of took us on this journey of 3D printing, and it just one thing led to another. And the first 3D printed toy was a G tube, actually. That was one of the most requested items at the time. That's where we initially just made a very simple printed tube, and a later rendition of it is where it could actually open and we could plug the feeding line in. As we've been getting better at toy making, we've been making our toys better and more interactive. So
Yeah.
that is just like one thing after another. We have over 90 different toys now. So yeah.
That's huge. That is
Yeah.
massive. That is
Yeah.
amazing. And like the thing that I love is that I follow you on socials and have done for years, like since Ezra very first got an NG tube when he was 1. The thing that I love is when you show the different products on like Instagram, for example, and you can see in like a G tube in a teddy. And I love like the mini versions of like the ultrasound machines. Like it warms my heart when I see it. And I just think, there are so many kids. It's so unfortunate that we're in this position that we need this, but there are so many kids that have to go through these very extensive medical procedures and surgeries and, need things like NG tubes and G tubes, and to have something that there's tangible and they can use it on their toys and they can practice it, as part of play therapy and things like that. Like, brilliant.
Yeah.
Brilliant.
Yeah. I think as adults, we often forget just how powerful play is. When we make a new toy, like the recent scope we made for like
Yes.
endoscopies, I clearly know the power of these toys, but still reading the comments always surprises me of how many people said, oh my goodness, I wish I had this as a kid. I had endoscopies starting at 6 years old, or even colonoscopies. Like there's so many adults that are saying how helpful this would have been. So of course, like for our kids, we need to be offering them access to tools that represent their real life experiences, because kids like
Yes.
to play out what they do in life.
Absolutely.
They play house all the time. Like,
Yeah, that's right. They dress up. They play dress ups and they do
Mhm.
these things. And I think our medical kids, they need an escapism
Mhm.
for the real life of what they're actually going through in whatever level that is. I mean, obviously some kids it's maybe just one procedure, others it could be multiple a week. So it's nice
Yeah.
to have a space that's safe that they can enact these moments, or it's a way to express some of their fears and be able to go, I don't know if this feels comfortable, but maybe if I play, and they may not cognitively be thinking, oh, this is what's
Yeah.
going on, but they certainly know how to express through play.
Right, and it turns their care into something they're empowered and in control of in play.
Yes.
Play does tap into the subconscious and implicit memories. So, where they can't verbalize fears, it's still by playing with these tools, it is still helping rewire those fearful connections or trauma they may have around it.
Yes.
So, there's so much science coming out even now around the power of it. Lego just in 2023 released an MRI, and
Yes.
they did a study because they have resources, thank goodness. So it showed that it reduced anxiety.
Lego as an example, you know how it feels when you're building Lego, whether that's your kid's Duplo or whether it's a Lego toy that you're creating together. It gives you some satisfaction. It gives you a sense of anxiety release. It gives you a purpose. It gives you an out. It feels
Yeah.
good. It's nice. So how does that must feel for the kids? You know, like it must feel good.
Yeah. Yeah, there's more studies that showed just medical toys in general. Like there was a randomized control trial in 2023 with a toy nebulizer, and it showed those that played with it, the kids' fear and anxiety went down. The kids who didn't have access to play tools after their treatment, their fear and anxiety around it actually went up. And that's the hard part is these when we think about kids getting medical care, their first experience is really what shapes the rest of it. And one bad experience can compound and cause lasting traumas and difficulties later on. So, if
Yeah.
we can really try to come in gently from the start and be aware that how we provide care can cause trauma, that we just need to be a little bit more careful in how we're providing care and more
Yeah.
child friendly.
Absolutely. And for us personally, when we ordered the G Tube button before Ezra had his surgery to go from the NG to the Mickey button, we actually had the little toy one and we showed him what would happen. We actually demonstrated it on him so he could actually see it. Obviously, we had the box from Avanos with the actual button in it, but because it's all sterile, we didn't want to open it before hospital. So we actually used the toy one and kind of, we didn't know exactly where on the stomach it would go. And we knew that it could go in multiple, could be the left side, right side, above the belly button, it could be anywhere. But we sort of played around with it and explained to him in a very basic way what was going to happen. I really think that made a big impact in his level of understanding for when we got to the hospital. He knew what was going to happen because he had seen this little button and he knew that he was going to get something that looked like that and it was going to go in his tummy and that's what the doctors were going to do. So he had a level of understanding. Was he still anxious? Was he still, a little bit upset? Of course. He was little. He didn't understand. He was only 2. I think it alleviated some of that stress because he did, on a very subdued level, have an understanding.
I was going to ask how old he was because another thing is the symbolic play. When for younger kids, they really need the realism to map like that toy or the play onto their own experience. So it is helpful to have like a physical toy that looks very similar to what he's getting, and it probably did
Yeah,
help. Yeah. And I think
I think it did. I absolutely think it
yeah.
did,
That's amazing.
which is
And
great.
that's where right now with the current toys that are out there that are medical toys, they look so far from the real thing that like for younger kids or kids with autism or developmental delays, like their brain literally will not connect the same process because it doesn't look like
No.
it.
That's
It's
right.
too
That's
different.
exactly. I think realism is important. And obviously, if you can't get your hands on the real product, or it's not something that you could bring home, I mean, you're not going to bring home an ultrasound machine because that's
Right.
not possible. So if you can bring something into the home that desensitizes that from fear, because I think that's such a big thing with the kids, particularly the younger kids. They're fearful of the unknown. In saying that, aren't we all a little bit like that? Probably yes.
Yeah,
So if we can desensitize some of that, then that's only going to be helpful, not just for them, but for us as parents and carers as well. And I'm sure from your clinical experience as a nurse, that would be something that would also help when someone's bringing their child in, that you go, this child has some understanding of what's going on. And I've used a machine like this on my toys.
yeah, it definitely does. My nephew has HLHS and he was getting a lot of echoes. And his mom asked me if we could make an echo. So, of course, we did. And
Mm.
she said normally he was kind of fearful of it, withdrawn while they were doing it. But once he had the toy, he marched into that echo room and started teaching the echo tech how to do his own job. So it
I just
really,
love that so much.
yes.
You
And
must love that even more. Like, it just must
yeah.
give you such satisfaction.
I keep thinking of all these studies that I've been reading about too, but it even shows that when parents are involved in preparing their kids,
Mhm.
it decreases the kids' anxiety, but it also decreases the parents' anxiety. Because
Yeah.
when we're bedside, even as a nurse, when I've been bedside with both of my girls in the hospital, I don't know what I'm doing. I don't want to overstep. I don't know how involved to be in preparing them. I don't know what my role is. And
Mhm.
that's where, if we had these tools, even at the bedside, for parents just to engage and play with their kid, it would be huge.
Absolutely. I mean, it would be great to get to a point where hospitals have actually got these products and these toys available for the kids to use on their toy, or, use alongside the text or whatever the case may be, so that they can engage in this play in the moment,
Yeah.
because we can prepare at home and we can do those things, which is, of course, helpful. But the anxiety hits when they're walking in those doors and getting their hospital gowns on and sitting in a bed and all, and then, the noises and the bright lights and the sterile environment and all of those things trigger the memories and the fear that the kids have. And obviously they, to some degree, understand now this is what's going to happen. But if they actually had that, play instrument that they could use alongside the doctor or the tech or whatever, that would be amazing. That'd be so cool.
Well, play lowers defense mechanisms. So that's where you'll see, even like on Daniel Tiger, I saw an episode the other day where the doctor listens to his teddy bear heart or lungs with a stethoscope first. And I'm like,
Yes.
that's really what this is. If they were bedside, you can show a little toy echo on this doll first, So it's
Yeah.
really just providing a resource for nurses and doctors to build rapport and trust with the kid too. Because they can
Yes.
show, this is what I'm going to do.
Yes, yes, and I'm sure the feedback you get from families must be similar, right? Like that these
Mhm.
these kinds of things. Obviously, you've just mentioned your sister, but people must come back to you and be like, "These toys make a difference."
Yeah, I do feel that our company is unique in that it is very easy to get testimonials, like in all the comments, and like the
Yes.
parents are so excited afterwards. They send us emails or we have a text line, and it is really nice to see. I'm terrible about saving those because I probably should be promoting them. Like,
Yes.
look at how big of a difference that.
100%.
I
Yes.
know.
Yes.
So I need
Advocate.
to start doing more of that, but they'll send me pictures and it is really cool to see because it really has helped so many families.
How did you come about realizing there was a gap in the market here?
I think that that goes back to, well, it was kind of a strange journey because I think
Mm.
it really initiated it as I was a nurse because I remember this one patient who she'd been in the hospital for a really long time. Her port got infected, so they ended up putting in a PICC line. I believe she had trauma around it because you have to stay so still during dressing changes and like as the tegaderm's coming off, it's uncomfortable and then it can pull out the line, then you need another place. So I went in just to draw labs and she did not want me to draw her labs. She was so scared. I remember the reporting nurse saying, try to do it while she's still asleep. I,
Yeah, that wouldn't
that
have gone down well.
I know. So I showed her that I was drawing labs, like put an IV in her teddy bear, and I'm like, look, I'm not dealing with the dressing. There's no pokes. This is exactly what I'm doing. She got super excited that her teddy bear now had it. So she was playing with it with the syringe. And then I couldn't leave the syringe in the room with her because I didn't want her attaching it to her own line. So I did the blood draw. Like she sat completely still. She did great. It was wonderful. But when I took the syringe away, she was so upset. So that's where I realized, okay, we need toys that kids can play with on their own that's safe.
Yeah.
So that's where I saw that. And then as I started making them myself, every single request we get is just like another, my goodness, yeah, why isn't that a thing yet? So we're constantly making new stuff. Any business owner or person I talk to in the
Hmm.
entrepreneur space says we have way too many products and that we need to dial it back, but we
Not in this
can't.
space.
I know,
Not
I'm
in
like,
this
we
space.
need them. Like, even if there's some products that we sell like one a year even. There's some rare
Yes.
things, but that's for one kid. That's huge. So,
100%.
so we're
100%.
probably gonna have 1,000 SKUs at one point.
Well, but getting testimonials and receiving feedback for any business, for the podcast, for everybody, it feels good. It's lovely. But when you put that item in its postage bag and it goes to that family, hand on heart, that that is going to help that kid. Even if it's just 5%, it is
Mm-hmm.
going to help that kid and it is going to help that family. And it's
Yeah.
probably also its knock-on effect. It's going to help the nurses and the doctors and the anesthetist and the lab
Yeah.
techs, and there is going to be this constant knock-on effect from one product that nobody else has available. Like
Yeah.
that's like I've got goosebumps. That's incredible. Like it's just it's really magic. I think
Yeah.
as a parent of a child who has got a G tube and has had lots of surgeries and has had lots of hospital intervention, these tiny things seem insignificant to people from the outside. Like, why would you want a fake button for a toy? Like, that doesn't make sense to people. But if they saw what that did to help him prepare for what the change was going to be, then I think that they would think twice.
Yeah, I know. We do get one-off comments here and there where people will say, "Why would you do this? Kids don't want to replay what they're living in the hospital." And almost feel bad because then all of the people reading that comment that know it's wrong just pile
Mm.
on and say,
Yeah.
"Actually,
You have no idea what you're talking about.
I know." And
But it's true. It's true.
yeah,
And it's probably coming from, in my head, is probably coming from someone who is on the outside looking in and just thinks that's weird. Or it's from someone who's deeply on the inside, hasn't tried this, but is fearful
yeah.
of giving it a go. And I think there's probably two areas in that aspect. That's what jumps into my mind.
What you mentioned before, even if it just helps 5%, one thing we've been working on behind the scenes is launching something else that'll address these other factors in medical trauma because you can prepare a kid so much. And then when you get to the hospital, if they're held down or if they get a poke without warning, or there's so many things that could happen that just cause trauma after that. It's unavoidable. Well, it is avoidable. So, what we're
Yes.
trying to do is we're making a framework and some more trainings around the way we provide care. So, toys are part of preparation for kids, but there is so much more to it in like respecting kids and ensuring they actually understand what's going to happen. There's a lot of different things we could be doing differently, but
Totally.
as a nurse, I also sacrificed kids' emotional safety for efficiency's sake. It feels terrible, but it's like, no, I have meds for all four of my patients. We got to do this now. But like,
Yeah.
did we really need to? No. And that's where I think we need to talk about that more is like, we need to think of is what we're doing to this child right now, if they're having resistance or distress, does actually have to happen right now? Have we tried other options? Do they know what's happening? Are the parents involved? Like, there's things we really need to think about with every point of care. This business is expanding even more. I'm hoping that it'll help with those other aspects too.
Yeah. Oh, it's just, yes. To all of those things. Yes. there is, even as a parent, you kind of know the schedule, like, you know that they're gonna come in and do obs, you know they're gonna come in and give meds, you know they're gonna come in at this time and do a blood draw. Whatever the case is, you generally know, more or less,
Hmm.
that what's gonna happen. So then you end up with a case of, well, I know what the next thing is going to be, but how do I prepare my kid for that when they're already so traumatized? Or they're
Yeah.
already so fearful, or they have already anticipated what the next step is going to be. In my experience, we've had two different types of care with our nurses, probably depending on what hospital we've been in, what staff have been on. Some are really great and they persevere with care and love. Others are not so great and they don't. They persevere with insistence and anger
Yeah.
and frustration, and probably due to those time constraints and, like, well, you need meds now, like, we must get this done right now, rather than going, I'll just go to the other patients and come back, we'll try again. Can you see if you can talk to Ezra about what's going to happen? You know what I mean? Like, and they'll come
Yeah.
back. Sometimes we've had that. Unfortunately, I think in most instances, particularly here in Australia in our public system, they are hugely understaffed, and it's probably the same in the States, hugely understaffed, and they got to tick their boxes and get things done. So they just push through, which from a clinical point, I get it. Like, I understand it. But from a parent's perspective, looking after my child, being their advocate, it's it's not great. And it only compounds that medical anxiety and that trauma that they experience long after they're, out of that hospital. It's what we have to live with that child
Yeah.
ongoing from that moment.
Yep, I know. And I've been in situations where my girls have had to be held down for different things. Actually, both of them, it was urinary catheters. And I remember at the time, like with the latest one, she's only 1.5, they weren't finding her urethra. And it was so traumatic. It ended up making her bleed a little bit because they were prodding so much.
Oh.
And I was thinking, while it was happening, I wanted to say no. I wanted to say,
Mhm.
let's stop this, but I couldn't. Like, there was something where, and like, that is where we need to really increase awareness and trying to empower parents to be more active participants too, because it was so uncomfortable. And I had her laying, I wanted to try to give her some comfort. So I had her laying on my legs so she could still
Mhm.
feel me. And I was
Mhm.
like, it's okay if the betadine gets on my pants. I don't care. Like,
Yeah, I don't
just, I
care.
want her
Yeah.
to have me here. But
Yeah.
she had to go get another nurse to hold her down. And she said, you're not holding her down hard enough. And then she tells the other nurse, she goes, she wanted her to lay on her lap, like in a weird, like it was like she
Sort of
didn't approve.
condescending.
Yes, and it was so uncomfortable, and then after that comment, I just froze. I wish that I had felt empowered enough to say, "Okay, you know what? Let's not do this. Like, let's do
Yeah.
a catch bag. Let's do something else." And
Yes.
that's
Let's
we
try
need
something
to.
different. Or let's just stop for a bit. Let's just have a
Yes,
minute. Yeah.
yes.
Oh, I'm
Oh,
so
it's so
sorry you had to
hard.
go through that, and so did she, more importantly. It's
Uh,
it's awful, and it's a similar experience with the NG tube, the pinning
Yes.
them down and pushing that tube through the nose, and Ezra had, like, 15 months of an NG tube, so we had hundreds of tube changes because the tube used to come out
Yeah.
all the time. He was very good, he didn't pull it, he would never, like, actively pull it out, but, we would be changing him for a bath and it would come out, or it would
Yeah.
start coming out because the tape would start coming off around the nose and we weren't quick enough to sort of go, oh, we need to replace the tape, and then the tube would come out, and
Y
so we had all these experiences. The pinning down thing is, look, it's awful for the kids because they're just scared of someone holding them down, and it's a threat. Your body and your brain it thinks this is a threat. But the parent who is either actively involved, like you were, in holding their own child down and keeping them still is almost worse, because
Yeah.
we have to be involved in a process that we don't really want to be involved in. And it's generally happening in spaces where you want your child to feel safe and comfortable, but they're
Right.
terrified.
They're too young to provide consent. So when
Yes.
we're holding them down, we basically gave consent on their behalf. So then it's like it feels so terrible that I this is my fault. I
Yeah.
subjected them to this.
Yes. Yes. And
Yeah.
you replay that moment in your head for hours, days afterwards, thinking, could I have done anything differently or better? Could I do anything differently or better next time? What would be a better option. We ended up getting to a point where Ezra was getting so big, he couldn't be wrapped in a muslin wrap anymore. We used to wrap him in a cot sheet.
Yeah.
So we would literally lay him down and wrap him like so tightly in a cot sheet to try and provide some restraint. And then someone would be on his feet, someone would be on his body, and then the nurse would be putting the NG tube in. We got it down to a real fine art, to a point where it was everything was set up and ready to go before we would bring him in. We'd bring him in, we'd wrap him really quick, and then it was like probably under a minute and it was done. It was really quick in the end, but that took many, many, many times of
Yeah.
trial and error before that to realize this was the best way forward, which always perplexes me, because I think, how do medical staff, like the nurse in this case, it was community nurses, how do they not know these things? He was
Yeah.
not the only one on their books with a tube.
Right.
Surely there's a standard yeah, I would have thought there's
Well,
not.
you'd be
Well, not
surprised. I
here
know
anyway.
that's where there's a lot of guides on like clinically how to put an NG tube in,
Mm,
but the actual comfort holds and things aren't really taught in nursing schools.
no.
It's a lot of child life specialists would know. So I
Hmm.
think it's really odd that we're not receiving that education as nurses too.
Yeah.
It's funny because we'll go to my advanced cardiac life support class I did. They make you memorize the drugs for the certain heart rhythms and the doses. That's out of my scope. Like, I'm never gonna use that. So why am I learning that, but I'm not learning like comfort positioning and
Yeah.
play? Like, it
Yes.
is
Yeah.
so
Or
weird.
what things could you say to a parent when you actually have to say to them, I need you to hold your child? That's not in a parenting book or in a preparing to have a baby, what to expect when you're expecting. There's no section in there about having to have your kid fed, or your baby, your newborn, in a lot of cases, newborns. So you've
Yeah.
got to hold your baby. It was
Yes.
hard enough trying to do it at one. But
Ugh,
at least I
yeah.
knew him. I knew him then. But a newborn? Having to hold them down, and, or young, within that first 3 months, it would be horrendous. It would be
We
horrendous.
had, my 1.5-year-old was in the NICU for a couple weeks because she had
Mhm.
severe hypoxia at birth, and she was not eating on her own. So they did
Yeah.
end up putting in an NG tube. I remember the night they told us they were putting it in because they told us she was doing great. And then all of a sudden we called at like 11 and they said, we're putting in an NG tube. And we said, wait, what? I thought she was eating fine. And then they said, no, she's taking too long. So we said, wait, we'll drive in and we'll sit with her. Like, do you need somebody to sit with her? What they didn't explain at the time that took us over a day to figure out the why of why they put in the NG tube was she was taking so long to eat, she was burning calories more than what she was getting in.
Right.
So I don't
Okay.
know why that wasn't explained. So
Yeah, that could have
we're
been explained a
driving
lot
in
better.
and we say, don't do it yet. Like, let us get there first.
Mm.
And my husband actually drove in because I was here with my daughter. And he gets there and he's locked out of the room for 30 minutes. By the time they
Mm.
open it, the NG tube was in. So we were so upset, mainly because we thought that it was a miscommunication, but also I believe the doctor was thinking, no matter what this conversation is, we have to place the NG tube for their care. So let's just get it done before the parents come in. So it's not a fuss, right? But they didn't think about like, I wanted to be there. My husband
Yes,
wanted to be there to comfort her, even like
exactly.
just to hear our voices and like,
Yes.
yeah, she's a newborn and she might not have episodic memory, but like it's gonna live in her body that somebody
But
held
it's
her down.
not just her, it's you. It's your
Yes.
husband. It's how
Yeah.
you feel as parents not being able to be there. It's not just, and this is, I think, a misconception that people on the outside, and I'm sorry, but doctors and nurses who were caring for you at the time, they're on the outside. They're not in the inside. They're
Yeah.
not in the inner sanctum, and what they fail to understand in a lot of cases is that a lot of what goes on and a lot of what needs to be done is not about the child. It's about you as a parent and what
Yes.
you need to provide to your child as a parent. Ezra at the beginning of the year was in PICU for 3.5 days. It was planned. It was after a surgery that he had. So it was planned. He needed to be sedated. He needed to be quiet. He needed to have complete vocal rest so that his surgery could heal properly in his throat. We knew it was going to happen. And I can remember, the staff were amazing. They were fabulous. But I can remember them saying to me, do you want to go and get food? And I was like, oh, no, no. I was on my own at that stage. And I was like, no, I'll just wait till my husband comes. And they were like, it's okay. He's not going to wake up. And I was like, that's what? I don't care that he's not going to wake. Can he hear my voice? And she goes, oh, yeah, I can hear you. And I was like, exactly. That's why I'm not leaving. He can hear me. He knows that I'm here. He can hear me clearing my throat. He can hear me blowing my nose. He can hear me walking around his bedside. He can smell my perfume. He knows I am there. If I walk out and someone else in our inner sanctum is not there, he knows I've left him. And before he went into surgery, I said to him, I am not leaving you. You will not be alone. So whether that's a newborn at a day, 2 days, a week old, or whether that's an older child, it doesn't matter. It's what you have to do and have to provide and want to provide as a parent. And particularly, like, I've never ever, thank goodness, never had to experience NICU, but from my understanding, my sister had to go through the process with her baby. It's an experience like nothing else. You
Yeah.
have given birth and you are separated. So if there's some intervention that needs to be done, and whether you were going in to argue about it or not really the point.
Yeah.
You deserved the right to be there, to comfort your child, but also to give yourself some comfort.
Yeah.
Everything was okay. You were together
Right.
rather than her being alone. And effectively, your husband's alone. He's standing on the outside of this room, locked out, can't get in. How horrible that must have felt.
Yes, and that we talk about it a lot, like how traumatic that night was. And because it made us feel like we had no power, we had no control, like her care is completely out of our hands. And it was really because it's scary leaving the hospital every night with strangers, really.
Yeah.
And like you hear the stories of things that can happen. Thank goodness they were, but aside from that one miscommunication, all the staff was wonderful. Even that nurse we made up with afterwards after we figured out the miscommunication. But like, that's where we need to recognize these things going forward too, is any time that something is being done to a child, the child, if they're old enough, should understand what is happening and why. But same with the
Yes.
parents. We did not understand why it was happening. So why were we not why was it not explained to us? It's just such a bizarre
Absolutely.
thing.
Absolutely. I agree. And I think I'm sure this happens to you all the time because you are a nurse and people just assume that you will know, or people assume that you know because you're clinically trained. I know Ezra's everything, all his nuances. I know all his doctors' names. I know all the procedures he's had done. You know, I can rattle everything off the top of my head. But that's almost a fault because when I articulate that to doctors and nurses, they just assume I know everything. So they leave bits of the conversation out because they think I understand it all. I have a high level of understanding, but I don't know it all.
Yeah.
So don't assume that I know. You could preference the conversation with, you may already know this, but da 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 da. And I can go, yeah, 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 yeah. Or I go, oh, no, I didn't know that.
Right.
Thank you for telling me that. So same thing with you. Just because they know, well, Mary's a nurse. She'll know
Mhm.
this. She'll know the reason why her baby needs an NG tube. You're a parent in that situation, not a nurse.
Yeah.
You know what I
Right.
mean?
And
Your
I was
brain
never
is
a
not
NICU
in
nurse.
work mode. Your brain is in mum mode. And
Yeah.
I've just given birth mode. So you're not thinking about that. And I think that sometimes that gets forgotten. If you've got a high level of understanding, whether that's because of your clinical training or whether that's because you do just understand and you can talk the talk, does not mean that the whole explanation shouldn't be given to you, because things
Yeah.
get missed and left out. It sounds to me like the butterfly pig is moving in a direction beyond the physical toys, which are amazing. It certainly sounds like things are expanding in that space where this kind of stuff is going to be talked about.
Exactly. Yeah, it is going to have more frameworks for hospitals to follow, empowering parents or anyone on the care team to be able to initiate a pause in like the non-emergent
Amazing.
scenarios. And then part of it too is like a huddle afterwards. So if you have an incident where you had to hold a child down, we need to talk about that after. Was there a moment where we recognized their distress before we got into a point where we couldn't go back? Like, could we have provided better education to them and just really getting us talking about how to prevent that again in the future? And recognizing after something like that happens, if we just ignore that it happened and move on, that can cause that compounding medical trauma. So we need to address it. Can we get child life to the bedside? Is there something we could do to help talk about it and rebuild trust?
Yes.
Yeah.
Yes, absolutely. It's just so, so good. I'm not sure if you caught the episode that I did with Amy Tran, who was another tubey mum. And thankfully, her little boy Thomas is now tube free, which is amazing. But she actually talked about going to the hospital and being told Thomas needed to have a tube. There was no consultation. There was no, come and sit in this room, have a conversation. Here's some literature. Here's some websites. Here's some whatever. No, nothing. We're putting an NG tube in. Does this sound similar to you?
Yep.
This is what you've just been told. Same thing, different ages, same thing. Same thing with us. We turn up at the hospital. Ezra's failure to thrive. Okay, what does that mean? Like, I'm sorry, I'm breastfeeding him around the clock. How can he possibly be failure to thrive? Well, he's gone from this percentile to this percentile, therefore he is failure to thrive. So we're going to put an NG tube in. There was never a discussion. There was never. This is what an NG tube is. This is how long we keep NG tubes in for. Worst case scenario, best case scenario. These are the steps forward. This is what will happen. Nothing. You just get,
Yep.
they're having it and there's no conversation. And I think that needs to stop. That needs
Right.
to stop. Parents need to be given the grace and the respect to digest, understand. It's not just your child's life that changes physically because they've got this tube. You have to change. You might not be able to work anymore. You
Right.
might need to have a carer at home with you. Who else in your home needs to know what's going on? For us, we had two other kids. They need to
Yeah.
know. You know what I mean? Like, there was none of this conversation. They just think we just need to get this done. Which again, same as the conversation this nurse had with you and what the doctor said. That may not change the end game. The end game may still be this is going in whether you like it or not, because we need to look after the nutrition and the health of this child. That's okay. But what is an hour going to do, or 2 hours going? Is the kid going
Right.
to die of malnourishment in the next 48 hours? No. Okay, so give us a minute to digest us. Give us some information. Show us what it looks like. What kind of food do we feed them? How long does it take? How do you keep the tube to the face? What do you do with the rest of it? Where does it go? Like, there's a
Uh,
whole lot of stuff that goes along with an NG tube, because generally that's how they start. Very few kids just go straight to a G tube or a GJ tube. They go NG and then they graduate from there. But you don't get the time to just understand how this is going to affect your life. And it
right.
does. It
Yeah.
affects your life. If they had some of these tools available in the hospitals to be able to have these conversations, and it could be a social worker having the conversation, it could be a counselor, it could be the dietitian talking
Right.
about how this works. There are multiple people in a hospital that could provide this support. I mean, you've got much better clinical background than I do. So that you could probably think of a half a dozen people off the top of your head that could do this.
I know. I remember being extremely frustrated because at that point, I think it was as early as day 7. The only thing keeping her there was the NG tube. I wanted to bring her home because when
Yeah.
I asked, when is it coming out? They said, we don't know. We're not sure how long it'll take for her to get enough stamina to finish a bottle on her own. That's where I never say about my background. I'm never saying I'm a nurse because I don't want them assuming I know everything. But at that point, I said, I'm a nurse. I can handle an NG tube. We can place it if we need to. We can place it at home. They wouldn't let us take her home with it. It ended up being from like day 7 to day 16. And all that time, she could have been at home. I could have been cuddling her skin to skin. I know they
She
have
could have
their
been with her
reasons.
sister, your families, like just in her space, in her room, in her
Yes,
bassinet, all of those things.
I know. I know they must have their reasons, but it is hard the way that care is we thought we were going to bring her home and they say no, we're putting an NG tube and then she's stuck there until it's out. Like what?
And this is the thing, why? And why is there no explanation?
Yeah.
not having an explanation is not good enough, in my opinion.
And my husband, when he was there, granted, when his children are threatened, he probably has a very angry voice. He's not like
I
an
probably do
angry,
too.
intimidating man, but he was probably a little mad. So I'm sure that had something to do with it. But he said the doctor told him at the time, I have had this many years of training in this. You have none. I know what's best for your kid. And he said it was very condescending, not good. But it's almost like, okay, yes, so teach me. Just tell me why. That's all
Yes.
I need to know.
Yes, absolutely. Yeah, I agree. To me, it just sounds like this package that you're working on is just going to be hugely life changing for not just the staff in the hospitals, but also the parents and, of course, the children who are experiencing this. And I guess as well, it comes down to, not just the kids anymore. It moves into adult life as well. You know what I mean? Some of these kids are going
Right.
to have these tubes forever and they may not be able to advocate for themselves ever.
Well, one of the worst things that I've seen in my social media posts where I'm talking about medical trauma, it is all of the adults saying that because of their trauma, even one traumatic experience as a kid, they're avoiding care now. I worked in adult oncology for a while, and there were so
Mhm.
many patients that were really late diagnoses, and you wonder, why didn't you come in sooner? And a lot of the time, it's because of their past experience with medical environments. And that, like, if we can start addressing preventing the medical trauma from childhood, it's going to help entire public health sectors, because right now delayed diagnosis is really an issue for a lot of adult patients.
It will continue if it's not
Yeah.
addressed appropriately at a young age, being able to use play and these types of toys and being able to teach the people who need to be taught better ways to place urinary catheters and NG
Yeah.
tubes. And I'm sure there's a whole host of other things that children have to be held down. They get something stuck in their foot and they have to be held down in order to get it out. Could be a splinter or
Yeah.
a bit of glass or who knows. But there are lots of reasons why children have to be held to be able to do something or remove something. It doesn't have to be a chronic illness. It doesn't have to be
Yeah.
something ongoing. It could still be a one off. But like you said, that one off could delay them receiving care or diagnoses from that one
Yep.
incident.
Well, that's what I find really interesting is, like, even with vaccines, I don't know why we're not routinely using numbing mechanisms, because they have numbing cream, but I know that's a little expensive, whatever. They have the cold spray, like the cold spray numbs it, or the buzzy. It's weird because when we took in my daughter, the younger daughter, for vaccines this last time, they brought in her 3 vaccines she was getting for the day. And then I had to ask, do you have the buzzy available? And then they said, oh, yeah, we just got those. So then I said, okay, can we use it? Since she had to go out and get it. I uniquely knew to ask for that because in the space know
Yeah.
about it. But why
Yeah.
aren't we using that all the time? Like, we should
That's
use,
crazy.
like, the numbing creams, numbing sprays, the buzzy,
Yes.
anything, so we can prevent trauma from happening. I don't know why we're not doing that.
Vividly remember this story. When I had Kira, my eldest daughter, who is 16. I remember when I had her having to take her for her routine vaccinations, and my mum saying to me, give her some Panadol just before you go. And I was like, why? And she's like, just so that if she gets any pain or she gets fever or anything, it's already in her system, it's already starting to work. And I was like, oh, no, I'll just wait. She's like, would you wait? If I could tell you were going to get a headache in half an hour, would you take Panadol? And I was like, yeah, I guess. Yeah. I don't want a headache. So you can preemptively expect that she is going to be in pain and she will have a fever. You can do something about it. You want to do something? And I was like, yes, good point. Okay. So all my kids, about half an hour before they were due for their vaccination, would have Panadol. I always thought that was a really interesting way of looking at it. If you
Right.
know it's going to hurt putting a needle in, which it's going to, and you could do something to stop it or, reduce it, wouldn't you do it? Yes. So let's do it. Let's do
Right.
the things that we can do. You don't get an extra medal because you've been brave. It doesn't make a difference. I think it's always funny when Parents are like, I've taken my kid for their vaccination. They were so brave. My kid cries, but that's okay. I'm okay with that.
Yeah.
Why have we got this, preconceived conception that not crying or not feeling emotion to something that physically hurts them is good?
Right. That's another thing that I have been talking about recently too is like even as a nurse, your patients that just kind of go with the flow and let you do whatever to them, it's not a good sign. Like kids feeling safe enough to express emotion and be able to be upset or even throw a tantrum, that's a sign that they still like feel empowered and that they feel like their voice is being heard or they want their voice to be heard. It's a good thing when they experience emotion and show us that.
I agree. We're very big in this house, particularly with Ezra, but all of the kids, that if you feel a certain way about something, that's okay.
Yeah.
If Ezra feels scared about going to surgery, that's okay. He's allowed to. We
Mhm.
don't need to go, oh, you'll be fine. Everything's fine. But it's not fine. It's not
I know.
normal. And it's okay. And you go, it's okay to feel scared. I feel scared before I go into surgery. I feel scared before I see a doctor sometimes. That's okay. And do you want to talk about it? How much he understands it for, I don't know. But I have always made the assumption that I talk to my kids as if they can understand everything and
Yes.
just hope that that helps them in some way rather than talk to them like they understand nothing.
Right. That is the biggest thing that I was in nursing with pediatrics before I had kids. And I'm embarrassed by the way I used to like talk to kids because I don't think I truly got it. I know. And now like kids are so smart. They understand everything. Like
They
we
do.
need to respect kids as much as we respect other adults. Like
I
we
agree.
wouldn't hold down an adult for a vaccine. So it is,
No.
but we could explain to them what's happening, say, we're going to do numbing cream. Watch. Do you feel anything? Okay. Now put,
Yes.
I don't know. There's so many
Yes,
things.
100%. But these are the things that we need to talk about so that they get explored. Well, that's the hope anyway, is that if we talk about these things, more people will be aware of it. And hopefully someone will do that. They'll take their kid for their vaccination and go, do you have any numbing cream? Or,
Right.
have you got any cold spray? Because if they do, then that's probably going to help your child. And that's a good thing.
Right. I'm considering buying some myself just
I
so
was just
I can
thinking
have it.
that. I was just thinking that. I was like, that could be a good thing to have in the tubie bag.
Shifting the culture of healthcare is that bigger task because healthcare, it's so much of, oh, this is the way things have always been done. So that's why we do it. And we need to challenge that. It's 2025, a
Yes.
lot more resources now.
Absolutely. And we have the ability to create new resources. We
Yeah.
don't have to do something because that's how it's always been done. We can do things a different way because we can rewrite the rule book. It doesn't have to stay the way it is. I think that that's something that kids teach us. There's lots of different ways to get from point A to point B. There's not one size fits all. It's different for everybody.
Kids are it's, so emotionally intelligent. And it's so funny how sometimes, because we're very open with our emotions and stuff. So if I'm feeling stressed out or something, and I tell my daughter, asks me, and I tell her what's going on, she always has the most straightforward solutions. Like I'm like, oh, somebody said something not too nice on a comment or something. Then just stop thinking about it. And I'm like, that's a great
You're so
question.
right. Yes, I do
But you're
need to
right.
do
Why
that.
am I dwelling on it?
Yeah, yeah, they do really put things into perspective, don't they?
Yeah.
Yeah, I agree. They do come up with some funny things, and I have these conversations with Ezra's preschool teachers pretty much every time that I pick him up. He's been through a lot in his 4 years on this planet, and I think he is wise beyond his years because of his experiences. I'm positive that
Yeah.
other kids who have been through similar experiences probably get the similar comments. Hilarious. Kids that have been through traumatic experiences, particularly medical ones, I think they're very wise beyond their years and they know a lot. And hopefully they'll be the next group of, kids coming through that will be able to keep doing this kind of stuff, changing things for other kids moving forward and being able to talk about their firsthand experiences. There are lots of
Yeah.
advocates, young people now, older teenagers and young adults that are definitely trying to change things worldwide. Oh, I support them 150%. They're doing
Yeah.
everything that they can.
I know. I That's the neat part about this business is I've been immersed in a lot of people trying to do similar initiatives, and it's really hopeful to see how many people are trying to change things for the better.
Absolutely. And you're one of them.
Yeah.
And we thank you.
Well, thank you. You are too.
Thank you. I appreciate that. I really think that that's a great place to wrap up on, talking about hope and young people of the future. I think we know where things are headed, and hopefully it's a better place than where we are now. I look forward to
Yeah.
seeing how all of this rolls out for you guys and watch it unfold. And I hope that you can get some of those resources out here as well in Australia, because we need them too.
Yeah. I
We
know
definitely need
they're
them.
definitely it'll be accessible. So that should be
Awesome.
totally doable.
Awesome. That is great. Yeah, because we definitely need that kind of stuff here. Thank you so much for joining me today and talking
Yeah.
all about the butterfly pig. I will link the website and all of the socials and everything at the bottom of our show notes and on YouTube so everyone can find you. And please share far and wide, because this kind of information and these products are truly not available in just regular toy shops. They're not available pretty much anywhere. So you need to make sure you've got this link saved and share, because it really makes a difference. Particularly if you're like a play therapist or something, you should have some of these tools in your toolbox as well. So have a look at that. Until the next time, stay safe and we'll see you soon.